Hello, I am Dr. Kelly Gardner, author of Everything You Should Have Learned in Psychiatry School But Didn't. Please check out my website as well because there's a lot of free handouts there for your patients and caregivers. My website is for clinicians, as is this video, for anyone working in mental health care. Today is a kind of interesting topic. It's about frontal lobe syndrome. I have another video coming up on frontal lobe syndrome unmotivated type. But today I'm going to focus on frontal lobe syndrome, sexually and socially inappropriate type. And there's a chapter of my book on it. And this topic is important for you to know because this is something that I wasn't taught in school and none of my students were either, because I do precept students as well. So let me explain this to you because I don't want you thinking that somebody's a pedophile or giving them that diagnosis, which is grossly inappropriate. These people are not predators. They don't go out looking for victims. Frontal lobe syndrome occurs due to any type of changes in the brain. The frontal lobe is the executive function part of your brain where your forehead is. It helps you to do tasks and that take multiple steps to complete. It also helps you skip over inappropriate things and make sure that you do appropriate behavior. If that part of your brain is injured, then you can get inappropriate behavior. It can happen with people with serious and persistent mental illness because the brain changes just from that. They don't have to have had a stroke or head injury. Or a lot of my patients in bad areas, they've been hit over the head before and robbed a bunch of times, or victims of domestic violence, you name it. Any type of head trauma can cause it, especially in the frontal lobe area, or the back of the brain, because the brain bounces forward and then back. Another place that you will see people with frontal lobe syndrome is nursing homes. That's where I first experienced frontal lobe syndrome patients. And I realized something had to be done because what was happening is I would get a report that my patient fondled somebody, fondled a male, fondled a female resident, and then they would have to call the families and let them know what happened. Well, I'm thinking the kids of this guy are going to think their dad's some kind of pervert or something, instead of understanding that it's a brain problem and it has nothing to do with the type of person he is or was prior to the dementia. Remember, dementia plaques would be in the frontal lobe, vascular changes, whatever. One of my first patients that had frontal lobe syndrome was a biker dude that got both his legs broken. So he's in like his 30s, and they didn't mention anything about brain trauma, but both of his legs were broken in the biking accident, so it was a pretty bad one. So because of that, he was in bed, in traction and casted, and surgery was done. The nurse assistants would come in to help clean him up, and he'd grab their boob or this and that, and was very inappropriate with them. And I ended up interviewing his family members and his biker dude friends that would come and visit. He was always a gentleman to women. He was not sexually inappropriate in any way. He had utmost respect for women, was very kind and a gentleman. I asked this because I wanted to make sure this guy wasn't some kind of jerk or pedophile, or this was his nature to begin with. It was not. So you always want to check to rule out that they are a sexual predator. This guy was not. And then I investigated further and requested a neuroevaluation. He did have some brain injury from the motorcycle accident that did affect, what do you know, the frontal lobe. So what we had to do was do some creative problem solving. I ended up giving him the handout that I wrote on frontal lobe syndrome. And he said, "This is what I have." I said, "Well, you've been grabbing the nurse assistants inappropriately and trying to grab their crotches while they're doing care with you. And you can't do things like that." He goes, "I know it's wrong. I don't know why I'm doing that. Can I blame frontal lobe?" I said, "No." I said, "Don't go there." I said, "You do have frontal lobe syndrome, but we're going to come up with some ways to stop it." So I educated the staff that we always keep his hands busy with things, and two people do the care on him. Somebody will do hand washing and hand care, hand and nail care, while somebody else is cleaning him up so that his hands are kept busy. The other thing is he needed to be, his family members and people who cared about him needed to be educated on this condition so they knew what was going on. The other thing is, I had to talk to the discharge planner because when he went home, he would need to be in a supervised environment and out in the public with other people with him. Because these people, it can be very dangerous. Somebody may try to kill them, or they may hurt and, try to, grab somebody inappropriately and would traumatize that little kid or somebody. So you want to protect them so that they're safe and other people are safe from them. I have seen it go away over time. Actually, this guy's kind of did. It gradually faded. Because remember, the brain can heal for several years after brain injury. And people with dementia, the plaques get worse, the dementia gets worse, and sometimes those behaviors minimize over time. So it's not a hopeless thing. The other thing I want you to know is if you get patients that have been in the criminal justice system, they were arrested for fondling somebody in the store or whatever, you can look up and ask for the psychological testing that was done on the person. A lot of jails and prisons do the psychological testing to check for recidivism. And one of my patients, I requested the testing, and the neuropsychologist indicated he had frontal lobe syndrome. He didn't have any head injuries. We don't know how it happened, but an MRI and neuro report, EEGs and workups confirmed there was a brain injury to the frontal lobe syndrome. I don't remember the cause of it. Maybe it was a clot that went through there. I don't know. He was very young. So that patient got out of prison. He found a girlfriend, and he showed her the information, went over it with her, and explained everything, and she understood, and he was on the up and up with her. So you have to be careful with these patients. What are the treatments for them? Unfortunately, I don't know of any medicine. I have used Symmetril, amantadine, off-label, and that has softened some of the behavior. But you have to track it. If you're going to try these agents, you need to have a tracking tool to find out how often these things are occurring. Have somebody at the facility or caregivers, whatever, track the incidences of these behaviors so you know if your medicine's working or not. Some of the things that you're going to see in these patients are socially inappropriate behavior as well. If they're at a nursing home and they're having food, they'll just reach over and take somebody's dessert and help themselves or something off their plate without any remorse. A lot of times they don't feel bad for what they did. That's another thing that's really strange about this condition. They have poor judgment. They do things without considering the consequences. No remorse. A lack of awareness of the feelings of others often goes along with this. They may have some verbal abusive behavior or swearing and doing things impulsively. Another interesting case was a nun that I worked with that was swearing, and she was in the nursing home, early onset dementia and this and that. Well, the congregation would come and visit her, and she'd be dropping F-bombs on them left and right. Again, I didn't want the congregation to think she was a closet swearer, and they never know that, she has a mouth like a sailor, this and that. No, it's from the brain changes. This is not her. This is not her norm. So I gave them the information so that they would understand and just ignore that type of behavior. When I was talking to you about protecting people, I did have a guy that asked me for help. He got kicked off the bus. He couldn't ride the public transportation anymore, and he couldn't go to the library because he was jerking off on the bus and in the library when he'd be on the computer there. So he was banned from both places, and he felt bad. He couldn't really go anywhere or do anything anymore. This guy needed some help because I didn't want anybody to kill him or hurt him or him to maybe transition and hurt somebody else somehow. So what I did was I talked to the primary care provider, and I asked him if he would try Depo-Provera, which is a long-acting birth control injection for women. I didn't do it myself because I'm not going to monitor his bone density, his other hormones, and all the ramification of hormone treatment. This primary care doctor was kind enough to do that. He did have a background in endocrinology as well. So I explained that I'd like to try this agent on him, and it did work. The guy was fine. These behaviors stopped. A long time ago, I thought that maybe their testosterone was high, and that was the problem. It isn't. I checked their levels just for the heck of it, and they were low. So it's what's between the ears, not the hips. Another thing that you should know, that sometimes in nursing homes, people might urinate or defecate in inappropriate places. They may forget to wear clothes, or they might flash people or moon them. I wanted you to know that the lack of remorse doesn't mean you shouldn't be kind to these people. It's a neurological condition that is causing this. Their lack of remorse is from the neurological condition. So kindness is very important. And again, keeping them safe. In nursing home settings, you can come up with some clever ideas. We had a gal that was flashing the priest at church. She would lift her top up and flash him, and he would come in the nursing home and do services there. So what we did was we got her a jumpsuit that you can order from specialty shops. She couldn't flash them. She didn't do anything. We gave her things to keep her hands busy. So I want you to be creative and come up with creative problem solving. Also, these people need to see a neurologist. Don't forget that. They need to see a neurologist because of your diagnosis of frontal lobe syndrome. They need to see a neuropsychologist for neuropsych testing. And always put on your papers with recommendations. Then they can develop a behavior modification plan so that everything can be tracked. Behaviors can be tracked. Staff members and or caregivers, if they're out in the community, can be trained so they know about this condition, what to do about it, how to monitor it and track it, so that you know if your meds are effective and your interventions are effective or not. I do want to say I did try Paxil to cause erectile dysfunction in the guy that was jerking off at the library and on the bus. And he took it for a little while and didn't want to take it anymore. He knew why I ordered it. I was honest. So there's a lot of different ways to treat this condition. I do want you to know that you need to rule out a condition called, it's KLUVER-BUCY syndrome. And that's another neurological condition that you want them to look for. I don't know how you pronounce it. I think it's Clover-Bucy syndrome. That's why you need a neurologist involved and a neuropsychologist for neuropsych testing. And remember that if you order things like the Depo-Provera, you have to get permission, usually from a behavior modification committee, to make sure that you're not infringing on anybody's personal rights or well-being. The guy that went on the Depo-Provera was very well aware of why it was being used. He understood all of that. He just wanted to be able to ride the bus and go to the library again. And eventually, a caregiver went with him to both places, rode the bus with him, went to the library, and he was fine. So eventually, he got his privileges back. But that librarian had the caregiver's number if any nonsense occurred. So did the usual bus people. So the bottom line is you have to be very creative and always protect your patients and others to keep everyone safe in these situations. And there is a handout on frontal lobe syndrome that you can use. You can download it for free on my website. And I hope that this helped you better understand these people and make sure everybody's safe and that you treat them with kindness and everybody else does, and that you don't put a diagnosis down as pedophile or pedophilia. That's a totally different type of diagnosis and totally different treatment. Thank you for watching.